Hello, my name is Maria Ray. I'm a nurse here at Brooklyn Hospital in the cardiac catheterization lab. And I will be speaking to you guys today about a topic called What About Palpitations? And so before we get into abnormal rhythms of the heart, I think it's important to talk about how the heart actually functions. Now, palpitations are sensations or feelings of extra beats, fluttering or skip beats in your chest. Sometimes it's hard to determine what causes this, but it could also indicate a more serious problem in the body. So it is important to be aware of it so that you can speak to your physician if you do feel you are experiencing these things. So first, we'll go over a little about how the heart functions, and then we'll talk about a few of the more common rhythms and abnormal rhythms that you would see. So the heart is a strong muscular pump. It's a little larger than the size of a fist. Each day it can beat about 100,000 times and pumps about 2,000 gallons of blood through the body. It has 4 chambers, 2 atria and 2 ventricles. So the heart pumps blood to the body through an organized system of contractions of these 4 chambers. The heart muscle expands and contracts from electrical signals which control it. Now, everyone has a natural internal pacemaker which initiates this electrical impulse in the heart, and this is called the Sinoatrial Node or the SA node, and it's indicated here on our diagram by the yellow dot, circular dot in the right atrium. And then from this SA node, the electricity travels through the atria and then down to the ventricles along specialized fibers. If there is any disruption in this normal electrical pathway, you will have an arrhythmia. So an arrhythmia, it just refers to any change from the normal electrical pathway of the heart. Arrhythmias are abnormal heart rhythms where the rate can be too fast, too slow, or unevenly. The normal adult heart rate will be between 60 to 100 beats per minute, but an arrhythmia can feel like extra beats, fluttering, or pauses. Now, there are a number of different arrhythmias. We're going to go over just a few of the more common ones. So Sinus Bradycardia is when your heart beats too slow, so that would be less than 60 beats per minute. Sinus Tachycardia is when your heart beats too fast, so that would be more than 100 beats per minute. Then we have Ventricular Tachycardia, where your heart beats too fast due to abnormal electrical signals, and this specifically is the ventricles of the heart beating rapidly at more than 100 beats per minute. Atrial Fibrillation is an irregular heart rhythm where the upper 2 chambers of the heart, the atria, contract out of sync with the lower chambers, or the ventricles of the heart, and your heart rate in this rhythm can range from 100 to 175 beats per minute. And then we have ventricular fibrillation, which is disorganized contraction of the lower chambers of the heart, the ventricles, and this is life-threatening. So this is just a diagram, an animation of the different sinus rhythms that people have. So there's normal. The first heart you're looking at is when your heart is pumping with a normal sinus rhythm. Now, compared to that, in the middle is bradycardia. So sinus bradycardia, where you can see the heart is pumping slower than the first image. And then the third is sinus tachycardia, where the heart is pumping faster than the normal rhythm. Now, we'll talk first about bradycardia. So bradycardia is a slow heart rate. What is considered too slow can really depend on age and physical condition. Generally, for adults, your heart rate, if it's less than 60, that would be considered too slow, but there are some exceptions to that. In deep sleep, your heart rate can drop below 60. Also, adults who are very physically active or athletes can often have a resting heart rate of less than 60 beats per minute. And if you see in this diagram, just a normal sinus heart rhythm compared to a bradycardia, sinus bradycardia. So you can see the heart is pumping a lot slower. Now, there are causes of sinus bradycardia. Can include problems with the heart's natural pacemaker. Also, it could be due to problems with the electrical pathway of the heart. Sometimes people with metabolic problems such as hypothyroidism could have sinus bradycardia. It could also be a result of damage to the heart from heart disease or a prior heart attack. And then also certain medications can cause the heart rate to be slow. And symptoms can be a range of symptoms. If your heart rate is too slow, it can decrease the flow of blood to your brain. You can feel tired or weak. There's dizziness, lightheadedness. Sometimes people can experience confusion, fainting or near fainting spells, shortness of breath, difficulty when exercising, and then cardiac arrest is also in extreme cases. There are treatments for sinus bradycardia. People with borderline or occasional bradycardia may not actually require any treatment at all, but prolonged bradycardia or symptomatic bradycardia can be treated with medications or potentially having a permanent pacemaker placed. Next, we would look at tachycardia. So that would be a fast heart rate. Now, there are various types of tachycardias. We have sinus tachycardia, there's ventricular tachycardia, atrial or supraventricular tachycardia is also another rhythm. Sinus tachycardia is a heart rate that is too fast, but it has a regular rhythm. Now, ventricular tachycardia is caused by disruption of the normal electrical impulses that control the pumping of the heart. And so your ventricles are actually beating at a lot faster of a rate. Now, again, what is considered too fast for people can depend on age and physical condition. So generally for adults, a heart rate of more than 100 is considered too fast. And it can last for just seconds or for minutes or hours. And then if you look at the diagram, it's just comparing a normal heart rhythm to tachycardia, which is faster. Now, causes of sinus tachycardia and ventricular tachycardia also range. So the sinus tachycardia, the rapid heartbeat in your body is a response to a condition such as anxiety or fear, severe emotional distress, strenuous exercise, could be caused due to fever, some drugs, medicinal or street drugs. Anemia can cause it, increased thyroid activity, heart damage from heart attack or heart failure, or severe bleeding could cause sinus tachycardia. Now, comparatively, ventricular tachycardia, it can be life-threatening, most often caused by a lack of blood flow to the arteries of the heart, where the heart muscle is not getting proper oxygen it needs. It could also be due to cardiomyopathy, which is various diseases of the heart muscle, electrolyte imbalances, some side effects of some medications could cause it, illicit drugs such as cocaine, or cardiac sarcoidosis. And then these are just images specifically of ventricular tachycardia. On the left, you'll see the heart, normal sinus heart rhythm compared to a ventricular tachycardia. And then we have the animation of the ventricular tachycardia when your ventricles are beating faster than the atrium. So we'll look at symptoms now, symptoms of sinus tachycardia. Some people have no discernible symptoms, but others may feel faint, lightheadedness or dizziness, palpitations. They can feel fluttering in their chest, a bounding pulse, chest pressure, tightness or pain or angina, shortness of breath or fatigue could all be symptoms of sinus tachycardia. And now, compared to that, symptoms of ventricular tachycardia, so brief episodes of ventricular tachycardia may not cause symptoms at all, but some common symptoms, if you are experiencing more sustained ventricular tachycardia or more longer lasting, you may have experiencing dizziness, shortness of breath, lightheadedness, feeling like your heart is racing, or chest pain, and that's another word for is angina. And sustained or more serious episodes of ventricular tachycardia may cause loss of consciousness or cardiac arrest. And treatment, so for sinus tachycardia, you really want to treat the cause of the tachycardia. For ventricular tachycardia, it will require immediate electrical defibrillation in pulseless, when you don't have a pulse with the ventricular tachycardia. You would also do a radiofrequency ablation or cardioversion if you do have a pulse, but you are in ventricular tachycardia. Then they could do an implantable cardioverter defibrillator device or treat with medications. The next rhythm is actually one of the more common arrhythmias. So this would be just an image of normal sinus rhythm versus atrial fibrillation. Now, in normal sinus rhythm, if you look at the image, you'll see that the heart chambers are contracting in an organized manner. If you then look, when it goes into atrial fibrillation, the atria are almost quivering, but the ventricles are still pumping in a normal manner. So they're not coordinated with one another. Now, yes, like I said, it is one of the most common arrhythmias, and it can occur when abnormal electrical impulses keep the heart chambers from pumping in a synchronized way. And so fibrillation of the atria is when it's not pumping properly, but it's actually, like I said, quivering. And this quivering can actually make blood sit and pool. And when this happens, clots can develop. Now, the danger is if a clot leaves the heart and travels to various parts of the body, to the brain, lungs, etc., it can cause a stroke, and cause pulmonary embolism, ischemic limbs, or heart attacks. So it is an important rhythm for doctors to diagnose and for you to speak to your doctors about. If you look just in the image, it showing normal sinus rhythm, and then the rhythm, your heart is in an atrial fibrillation, and it's actually an irregular rhythm. And men and elderly people are more likely to develop atrial fibrillation. So like the others, there are causes of atrial fibrillation. It can be due to high blood pressure, which is hypertension, heart attack, coronary artery disease, people with sleep apnea, congenital defects or defects you are born with, previous lung and heart surgeries, lung diseases, alcohol abuse, or metabolic imbalances can cause atrial fibrillation. And some people, in terms of just symptoms, some people with atrial fibrillation do not have symptoms, but those who do have symptoms may experience palpitations, weakness, reduced ability to exercise, and fatigue, lightheadedness, dizziness, shortness of breath, and chest pain. The treatments for atrial fibrillation depend upon the symptoms and the underlying cause. The treatment goals are one, to reset your rhythm and control the rate, and two, to actually prevent blood clots from forming. And so these treatments include cardioversion, medications for rate control and anticoagulation, ablation, which is a procedure that the doctor can do to damage or scar the tissue in the heart and the muscle that is allowing those incorrect electrical impulses to cause the abnormal heart rhythm. And then they can also do something called a left atrial appendage closure. So normally in the left atria of your heart, there is a small sac in the muscle wall, and it has no purpose, but people who have atrial fibrillation tend to develop clots because the blood is sitting and pooling in this appendage. So they are more prone to clot development. So the doctor may feel it's safer to close that appendage, and there are devices that they can use to close it. And lastly, just touch upon ventricular fibrillation, which is life-threatening. It is an abnormal heart rhythm in which the ventricles of the heart quiver due to disorganized electrical activity. If you want to look at the image, you can see the normal electrical activity and pumping of the heart versus the ventricular fibrillation, where electrical impulses are really just sporadic throughout the ventricles, and the ventricles are quivering, they're not pumping at all. And this often occurs in people with heart disease or people with previous heart attacks, and sometimes people who have electrolyte imbalances as well. This can occur in. And this is, like I said, life-threatening. You want to call 911 immediately or get the AED machine. This rhythm would need to be shocked. So, you know, overall, really, if you are experiencing palpitations or any abnormal feelings in your chest, you want to visit your physician, and they would be the ones to really help diagnose the arrhythmia. So they could do that through an EKG, or they might give you a Holter monitor to wear temporarily. So that Holter monitor device, it basically records your heart rate and rhythm and sends that information to your doctor, but it is very temporary. Usually people wear the monitor for 1 to 2 weeks, maybe at most. Another newer or device that the doctors are using, which can actually monitor your heart rate and rhythm for, it's not permanent, but for a little longer period of time, is called an implantable loop recorder. And we actually do those devices here in the cardiac cath lab. They could also give you a stress test, or they could do an echocardiogram on you, or even EP studies to look at the electrical activity of your heart. But just speaking briefly about the implantable loop recorder, it is not permanent, like I said, but it can stay in for up to 2 to 3 years, actually. So this is a picture of what the device looks like. And it records your heart rate and rhythm and sends that information to your doctor's office. And there are a number of different devices out there, but basically it can help diagnose arrhythmias that may not show up within 1 to 2 weeks. It might be something that you only experience occasionally, that your doctor doesn't catch on a one-time EKG. So they would be able to take the information of your heart rate and rhythm and actually help determine the treatment options for you, what certain medications you might need to be on, or if you need to have any further procedures. And the actual device itself is about the size of a large paperclip. Yeah. So ultimately, if you have any concerns, or like I said, if you feel like you're experiencing any abnormal heart rhythms or feelings in your chest, palpitations, what we want to stress is it is extremely important to see your doctor, make an appointment with the physician, because it could indicate there is something abnormal going on for you. And as always, if you're having chest pain, difficulty breathing, or shortness of breath, you know, you should not ignore those symptoms and should call 911, get to the hospital immediately. And here at Brooklyn Hospital, in our cardiology department, there are a number of doctors you could reach out to. Their information is on the screen if you do need to find a physician and seek care.